There are plenty of people that come in already full well knowing they're diabetic, but they're not getting what they want from their doctor, meaning their blood sugar is really not moving. They still feel kind of tired. They wake up and their blood sugar is still over 200. Doctor says it's fine, but they know it's not fine. They want more, they want help, and sometimes it's time to look past the natural thought process that the doctor has. So symptoms people usually recognize when they know they're not diabetic yet is they're urinating all the time, they're thirsty all the time, and they're just exhausted. A lot of times people feel like they have the flu and they don't realize that it's their blood sugar being really high. Sometimes it's neuropathy, that they notice numbness, tingling in their hands and feet, and that's usually one of the later stages, but sometimes people have been diabetic a really long time and never realized it at all. So for years, people have been treating diabetes in the early stages with exercise and lowering your calorie intake. Often people get put on metformin. Metformin is a drug that lowers your blood sugar, but it causes a lot of other problems along with it. Most people experience diarrhea, stomach cramping, and they just feel really sick. Meanwhile, they're still not losing weight and they don't feel much better. It's traditional for people to get put on metformin, and then from there they get more medications. They just kept getting added on more and more. We keep giving more medication because we have to keep up with our Band-Aid approach, lower the blood sugar, and that's all they know how to do. They're going to encourage you to run or walk every day. They're going to encourage you to eat less calories. We all know how hard that is. So the solution is, let's just give you another drug, and it doesn't work. What are we doing different than what, say, your family doctor, your endocrinologist is doing? We're restoring your metabolism that's been damaged for years of being diabetic or having metabolic failure. And it's a slow process, but once it's completed, you'll have energy again and you feel good again. Most doctors haven't heard of the program because it's a theory that's been out for over 100 years, but all that's really saying is, I'm making your body sensitive to your own insulin again. It's a very simple concept, and somebody found a way to make it come true, and InSolutions did it. So what's different in our program than somebody else's program? Most people aren't getting an IV with insulin, but for the purpose of restoring normal healthy function. And hopefully reducing the amount of medication you're taking at home. So I'm going to ask you to take less and get healthier. You don't have to be on insulin to be in our program. You don't even have to be taking diabetic medication. All we need to do is know that you have a metabolic disorder, whether it being diabetes, type 1, type 2, or pre-diabetic, and there's room for improvement. That's all I need. So I have a patient who's been in our program for about 6 months, and she asked me, did you weigh me when I first started? And I said, well, we weigh everybody. And she said, that I'm curious because all my clothes are huge on me. And I was like, what do you mean? So we weighed her. She had lost 23 pounds, not even trying. She didn't change her diet. She didn't change the amount of exercise she was doing, which is almost none. But the outcome, her metabolism was restored. So when she ate, she used that glucose for energy again, and it wasn't stored as fat. So to me, that's amazing without even doing anything different. We have one patient who was using a walker because her feet hurt so bad. She had stopped going to stores. She stopped hanging out with her friends or playing with her grandkids because she just couldn't walk. After 8 sessions, for her, the pain was gone in her feet, completely gone. She was able to walk around and go grocery shopping again and play with her grandkids outside. And for her, that was an absolute miracle that she never thought would happen. We do have one gentleman who was on our program, not long, probably about 12 sessions. He had a wound on his foot that hadn't healed in 3 years. After we had him on the program, his wound healed within couple months. So he reversed 3 years of going in and getting his foot scraped and looked at and bandaged, it's gone. And that's awesome that we can do that for somebody. I find it a miracle. A1Cs, I had one gentleman who came in, his A1C was 15.1, which is sky high. After he was in our treatment, even through Christmas, and he ate what he wanted over Christmas, his A1C now is down to a 9. So that's 6 points in probably 3 months. You just can't, things like this just don't happen without a really awesome program. If you want to get a free consultation, either click the link below or fill out the form, and we'll get in contact with you very quickly.